Breastfeeding, the effect of acculturation on breastfeeding habits in the U.S. Breastfeeding has been around since the beginning of time, and public advocacy for better federal and workplace policies for women who breastfeed have been on the rise. So why is breastfeeding so important? Breast milk is described by the CDC as the best source of nutrition for most babies. Not only can it transfer immune properties from the mother to her baby, but can also lower a baby's risk for conditions like asthma, obesity, and sudden infant death syndrome. It can also help lower the mother's risk of high blood pressure and breast cancer. Lower rates of breastfeeding are also said to add $3 billion a year to medical costs for the mother and the child in the U.S. In a 2018 report by the CDC, about 83% of infants start out breastfeeding, but this number drops to only 57% by 6 months and 35% by 12 months. Factors that contribute to decreased breastfeeding rates include inadequate workplace policies, like a lack of private locations when breastfeeding and rigid schedule standards, social stigma, and stress. However, race and ethnicity and acculturation rates can also play a big role in how long a mother breastfeeds her child. So what exactly are the acculturative effects on breastfeeding? Research shows that there are significant racial and ethnic disparities in breastfeeding rates and barriers among minority women. Racial and ethnic minority women have lower breastfeeding rates than white women and are further away from meeting the Healthy People 2020 goals, a set of breastfeeding objectives established by the U.S. Department of Health and Human Services. Because minority women are disproportionately affected by adverse health outcomes, the benefits of breastfeeding may be significantly greater for minority women. African American and Hispanic women have increased rates of obesity, cardiovascular disease, and diabetes. Those who breastfed exclusively for longer showed decreased risk of type 2 diabetes and were more likely to lose weight postpartum than those who did not exclusively breastfeed. African American women continue to have the lowest rates of breastfeeding initiation at 60%, which drops to a mere 13% at 12 months compared to all other racial/ethnic groups in the U.S. While there is less research on the breastfeeding patterns among American Indian and Alaska Native mothers, existing data shows that they have lower rates of breastfeeding initiation, duration, and exclusivity than other ethnic groups, except for African Americans. Apart from African American women, breastfeeding duration and exclusivity rates decline the fastest for these mothers when compared to other racial and ethnic groups. Although Hispanic women have the highest rates of breastfeeding initiation and continuation among all women in the U.S., there are still significant ethnic health disparities that must be considered. Hispanic mothers are currently not meeting Healthy People 2020 objectives for breastfeeding. They are slightly more likely than other racial and ethnic groups to provide formula supplementation as early as 2 days and have lower rates of exclusive breastfeeding. Acculturation also plays a major role in minority and immigrant women's breastfeeding rates. One study showed that foreign-born women were at higher risk of receiving the commercial influence of baby formula marketing without receiving proper breastfeeding education in the immediate postpartum period. This risk is especially high for those who are less acculturated and/or less English proficient, and for those who are undecided about their feeding method. Another study whose participants were recruited from a U.S.-Mexico border city showed that breastfeeding initiation was highest among women who were the least acculturated. It also showed that rates were lowest among those who were most acculturated, showing an inhibiting effect of acculturation. Although adequate support for breastfeeding benefits all mothers and their infants, it is particularly valuable to women who are more vulnerable, such as minority and immigrant women, who are at higher risk of facing health disparities. Further research must be done on minority women, especially American Indian and Alaska Natives, in order to better understand the socioeconomic and acculturative factors that influence their breastfeeding rates. It is also important that healthcare providers have early conversations with expecting mothers on breastfeeding education and potential obstacles that may arise during breastfeeding, which are even more crucial with racial and ethnic minority populations, who are more likely to have inconsistent plans of prenatal and postnatal care. By directly addressing these obstacles with the mother, healthcare providers can positively influence the future health of the mother and child.